Dr. Phillips, first question, can COVID infection cause liver damage?
Yeah, so initially when the pandemic broke out a year ago, a lot of studies actually mentioned that, COVID can directly harm the liver. And there was something known as COVID-related hepatitis also. But a year down the lane, we are actually more, richer in knowledge about what COVID does to the liver. So current data suggests that COVID does not directly harm the liver. So whatever happens to the liver in a COVID patient is because of secondary causes. For example, in a COVID patient who develops critical illness, he's in the ICU, he's on multiple drugs, antibiotics, painkillers, antifungals. These drugs are the ones that can cause abnormal liver test and liver damage, not COVID per se. And if somebody actually has multiple organ failure in severe critical COVID, they have multiple organ failure because of severe inflammation, that can actually harm the liver as part of the disease process. So there is no direct implication of COVID that can harm the liver. But there was one interesting report last year where they actually mentioned that by looking at the liver cells under the electron microscope of dead COVID patients, they actually identified virus particles inside the liver cells. But this was actually not so, because the particles that identified were not confirmed to be viral particles. And we had actually written a correspondence to the editor of the particular journal saying that, this is probably not right. And further studies actually disproved it. So there is no direct evidence that COVID can harm the liver, but liver injury can happen as part of severe disease, severe critical COVID, or it can happen because of other things that you do for the patient. For example, antibiotics, paracetamol, high doses, longer duration, painkillers, etc. That can actually cause abnormal liver tests.
What about patients with pre-existing liver disease? How should they be handling this COVID-19 infection?
So this can be considered in three scenarios. The first is when you say pre-existing liver disease, it can be as simple as fatty liver, or it can be something known as chronic liver disease, which is fibrosis of the liver, which is actually early stages of cirrhosis, or it could be cirrhosis, which is permanent damage to the liver. So if somebody has fatty liver, that fatty liver directly does not, it is not a direct risk factor for developing COVID or a bad progression of COVID. But if the fatty liver is because of obesity or diabetes, those are risk factors for getting COVID and having a bad clinical outcome with COVID. When you look at liver fibrosis, chronic liver disease, the chances of patients with chronic liver disease developing COVID is actually as same as what we see in general population. So this is very interesting because a lot of molecular mechanisms in a chronic liver disease or a stable cirrhosis patient actually protects from developing severe COVID. And this is very interesting because we've written a expert review on this particular matter, and that has been published after peer review, where we actually show from current evidence and current published data, we can actually see that very stable liver disease patients do not develop additional risk of developing COVID. But patients who have cirrhosis, who have unstable cirrhosis, for example, they have complications of cirrhosis, like bleeding or jaundice or repeated infections in the past, or ascites, which is fluid in the abdomen. These patients, if they develop COVID, they have a high risk of COVID progressing, which means they can actually have a very bad outcome with COVID that can actually cause more of liver injury and organ failure, etc. in that particular subset. So they are the ones who needs extra care and extra monitoring and things like that. But otherwise, simple fatty liver disease, early chronic liver disease, these patients do not have any added risk of getting COVID.
What about people with pre-existing liver conditions and, liver transplant recipients? Are they okay to take the COVID-19 vaccine?
Yeah, so we have this global society, there are major hepatology societies, the American Association of Study of Liver Diseases, European societies, Latin American and Asia Pacific. These societies have come together and they have recommended that all patients with liver disease, whether stable or unstable, post-transplant, even ones with advanced liver failure with cancers, can actually and should take the COVID vaccine because it is important. Now, why is this important? It is because if somebody has an unstable liver disease and they develop COVID, then the chances of them having a severe COVID is much higher. So vaccination actually prevents that severity. So that is one very important thing. Now, when you look at transplant patients, it's very interesting because transplant patients are already on immunosuppression. Now, if you look at how the virus attacks the body, the virus actually comes and attaches itself to the receptor. And once that attachment happens, you have this signaling downstream that actually causes the inflammation in the body that leads to all the organ damage. But all these liver transplant patients, they're already on some medicine, immunosuppression, which actually blocks some of these signaling pathways. The inflammatory pathways are blocked already. So if the COVID virus comes and attaches on a receptor, the complete downstream signaling does not happen. It means these patients are at a lower risk of developing severe COVID. They might get COVID, but it won't be as severe as what we see in the other risk population. And this is very interesting because to some extent, liver transplant patients are protected. So if you look at all the data that has come out from multiple publications from the West, Europe, and US, you can actually see that the number of liver transplant patients developing severe COVID is actually very less.